There, San Antonio, it's Dr. Brandon Grimm coming again from Dr. Golab's Chiropractic and Wellness. Today, I wanted to compliment a video that we did a few weeks back with the foam roller. But today, I wanted to talk about the lacrosse ball. I want to talk a little bit about using the lacrosse ball to get into some of those areas that we can't reach a little bit easier on our own, okay? So today, I want to talk about some of the common trigger points that I see on patients or that patients ask, how can I do that myself? And the first one I wanted to talk about is actually the upper trap. And I brought my trigger point book here. And so you can see the upper trap is kind of right in this area. And so in order to get into there, we need this lacrosse ball, and we're going to have to actually use a doorway. Alright, so to get into that upper trap trigger point sits right here on top of the shoulder area. So what we're going to do is we're going to take the ball, find that spot, which is typically going to be, you know, that little tender spot in there. Go straight into the doorway and just kind of work into that point. You can move the shoulder around, you can do some arm circles, and kind of work up and down on that point. But yes, we do have to do it in the doorway. It's not overly dignified, but hey, you're doing it by yourself, so you don't need to, nobody's going to be there to see it for you. So just get into that point, work it just a little bit. The muscle that we're going to talk about is the levator scapula. It's a muscle that works with the trap, and they do kind of the same things. And that trigger point is going to be right at the top of the scapula. So we're going to work into that. The best way to do that is we're going to take the ball, put it up over our shoulder to the top of the scapula, right there at the angle. Then you're just going to kind of lean back, kind of work into there, and again you can just kind of shrug that shoulder around, make some circles, but the most important thing is just to put a nice steady pressure into that trigger point. Okay? Now the next muscles we're going to talk about are a little bit further down the spine, and they are just inside the scapula, and those are called the rhomboid muscles. Another very, very common one that lights up for people who sit in front of that computer all day. Now, the easiest way to get into those is, instead of just walking the ball down the wall, is go steal you a sock. I brought my lovely Darth Vader sock today. So we're just going to stick the ball right into the sock, bring it all the way down to the bottom. It is not a weapon now. Alright, what we're going to do is we're going to use that sock to just kind of drift down in between that shoulder blade, and now I can easily trap the ball in between my shoulder blade and my spine, and just find those little tender points. And just the same thing, move the shoulder around, do a little dance up against the wall, get some motion in there. But again, the most important thing is to hold that steady pressure. The next common one that we're going to talk about is just to the side. It's actually on the scapula, and it's the infraspinatus. And there's typically one or two in there, and this one's just going to be on the scapula. So it's the same thing. We're just going to move over a little bit. You're probably going to have to angle a little to the side, and same thing. We find that trigger point, little steady pressure, do some motions with the shoulder, just kind of get into those tender spots. Alright, so the next ones we're going to do is we're going to actually move down to the lower body now, and there's two really common ones there. If I can get my ball back out of the sock, we're going to talk about the glute medius, which is at the top of the glutes. Alright, and then the next one we're going to talk about is the TFL, which is around in the front and on the side. This one we can actually reach ourselves if we want to, but it's hard to get enough pressure that we need. So the first one is that glute medius. I'll go ahead and use this side. We're just going to take that ball. It's going to be right at the top of the glutes. And then again, just leaning up against the wall. Put that pressure in there, steady pressure. A few little rotations around that trigger point. And just kind of work it until you start to feel that pressure fade away a little bit. And then the last one, that TFL, which really common in runners. Right here in the front, think about wearing a pair of jeans and having that fifth pocket. Right there where that fifth pocket is where that TFL is going to sit. It's about the same size. So on that one, we're going to dig right into it. And again, straight up against the wall. Find that little sore spot and just work right in there. And those are my common trigger points. If these simple little movements don't solve the issues that you might be having, it might be something a little more complex, please feel free to contact the office. Our number is 764-8888.